said that P2, if you take P2 kwa prostitute?
Prostinator.
That one.
Postina.
That one. If you take it during ovulation, it doesn't work. So is that true? Asking for friends.
Unfortunately, we have to protect
We must
us.
use there.
We
You
have
must take
to,
care
but
of your womb. It's your responsibility.
Wow. Got a
the
responsibility.
harsh reality. Harsh
I'm just
reality
like,
of
girl.
life.
Yeah.
If you don't do you, who is going to do you? Basically, what they do is they dilate your cervix and then now remove the products of conception.
Being a woman is tough.
It's tough.
Yeah.
And now the thing is, I thought when the baby will have come out, he'd have already like gone, but he did like 2 to 3 breaths, and that is what broke my heart. Because like he's gone through so much, you know. I'm just remembering how intrusive it was. You know, the day they do the centimeter dilation checking, it's something like that. But her whole hand was inside, and now she's scooping things out.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough health information to make you make an informed decision. My name is Dr. Hope, and today I have 2 lovely guests. I'll let them introduce themselves. And yeah, the way you want. Go ahead.
Hi.
Hi.
My name is Heather Wanzila. I'm a teacher by profession. I'm a founder of an initiative called Ignite Vijana. And I'm a lot of things you'll get to know by time.
Yes. I'm surprised you haven't said you're a mom.
Oh, yeah. I'm a mom today. I'm a mom of one. I'm a mom.
Okay.
From doctor to teacher.
Then
Then there's me. Hi, my name is Lily Ayisha. I'm certified yapper. I'm a florist. I'm fun. I don't have another title. That's just it for now.
You're not a journalist?
No, not anymore.
Okay.
I think that's why I call myself a yapper. Yeah. I don't want to make it like
A label?
yeah.
Okay.
Like
Professional yapping.
yeah. I think that gives me more money than journalism.
You heard that here. Welcome, guys.
Thank you.
Thank you.
I usually start off with a small segment called A Journey to Inside Out. Have you guys watched Inside Out? The movie.
The movie,
Yes.
I was like,
You haven't
yeah,
watched it,
the one
Heather?
for
I
emotions.
haven't.
Yes, the one for emotions. You haven't watched it?
I always hear in your podcast, have you watched Inside Out? But when I look for it, I don't find it.
For real?
Yeah.
I'll send you the link.
Send me the link.
Yeah,
Please. Yeah.
Sawa. So basically, they talk about emotions, and I just wanted to find out, where are you emotionally right now as we are speaking?
Today, I feel a mix of tension and happiness, like that warm mixture.
Yeah.
You are not too sad and you're not too happy.
Okay.
It's in between.
Okay. Tension. Nani anakutense? Trying to slow down. But that's nice. At least it's a mixture.
It's a mixture.
Okay. Lily.
I don't have a mixture. I'm just happy. I'm excited actually. It's been a while since I've sat like to talk like this. I just usually up on the IGs, but like professionally, it's been a while.
Okay.
Yeah, so I'm excited. I'm happy.
Yeah.
My emotion today is really happy. I've been happy since morning because I've been doing good things since morning.
Yeah.
So
What am I? Because we filmed one episode and I've remembered I didn't see my emotion. But my emotion right now is, I think I'm also happy. Yeah. It was a nice weekend.
You are always happy.
Me?
Yeah.
Am I always happy? Excuse me, behind there. Am I always happy?
Okay, I got you.
I feel like I try to be. I'm that person. I can be a high functioning anything.
Yeah.
Whether I'm sad, whether I'm happy, I can literally push it behind and show you what I want you to see. Yeah.
You're good at masking.
I'm in therapy, guys.
We thank the Lord.
But yeah, I think today I'm happy. Yeah. It's nice to be back to shooting. I'm a certified yapper as well. I think by now you already know that. Yeah. So this is my happy place.
And you guys, Hopi was not a yapper. I don't know where you got your yappiness from.
I've always been a yapper.
No, girl. I've known you for so long. And now I just look at you and I'm like, girl,
Where did that come from?
who alitoa wapi? No, but I'm happy. It's
Imagine
a good,
even I don't know where it came from.
which we just appreciate
Yeah.
that you have this space for us.
Thank
Because sometimes I
you.
don't need to call a doctor to ask for anything.
Yeah.
I just need to log on to Hopes and I'm like,
Yeah.
And then she teaches us things, International Day, what?
I know,
I'm like,
yeah. Every month there is always
There's
something
something.
awareness.
Yeah.
Something awareness. And it's such
I
a
keep
nice
saying
thing.
learning is fun.
Yeah.
I really love learning and teaching people. I keep saying in another life I could have been a lecturer. My only issue, a teacher. My only issue is I don't know who's going to mark the papers. For real.
You
None of
write
them
a
mark.
lot.
No, the students. Who's marking their papers?
you?
See the teacher?
That me, I don't want to
You
mark.
don't want
you
to
don't want
mark.
to
Yeah,
mark.
I don't want to
Okay,
mark.
makes
And then
sense, makes
also, it would be university. The numbers of students.
Yeah.
Siwezi. So if I could outsource that, fine. Yeah.
Only you too.
You too. Because I love teaching, I love talking. Yeah. Okay, Sawa. Medical jargon. Is there anything you want me to debunk? Or is there anything you would like to debunk?
I would love you to talk about antibiotics and children. Antibiotics and children.
Oh, girl. Okay. Anything in specific, in particular?
Like when you take a child to the hospital,
Yeah.
there is always measurements, then there is an infection.
Oh.
And then that infection has to be given an antibiotic. Is it because it is medical business or
Wow.
Call
Wow.
them.
I'm Kenny.
or
Sasa.
an antibiotic should be given for every infection?
Okay. I like that question. So, antibiotics are only used to treat a bacterial infection. So, if you go to hospital and they do a blood test, which you must, I keep saying this, which you must. If you have a bacterial infection, a blood test needs to be done, or a urine test, depending on where the focus is, just to confirm. Then once you confirm that it's a bacterial infection, then you can give the antibiotic recommended for that bacterial infection. So not all infections are bacterial. There's viral, there's fungal. So that's why I keep saying for like a common cold, most of the causes are viral. So if you're taking antibacterial for a viral infection, it's doing nothing. Yeah.
Okay. We hear.
Yeah.
We hear.
Does that
That's
make sense?
Yeah, it makes sense a lot.
Thank you.
At least next time, I have some content to argue
Yes.
with the doctor.
And the doctor says,
But you're not going to argue. No. You're not going. You have to converse and to make
To
an
converse,
informed
yeah, to
decision.
converse, yeah.
Yes, yeah. But it's true.
Thank you.
I really like this because for me the aim is to make people empowered. So that you're not just sitting. Someone is telling you, "I go and take this." Ask the
Yes,
question:
thanks,
What am
yeah.
I taking?
Yeah,
Why
what
am I
is the
taking it?
infection?
You know
Yeah,
what are side effects? Yeah.
Thank you.
Lily.
You know, when we sat here, I saw someone saying that please do not judge me with the question I'm about to ask.
This is a safe space.
Thank you.
Yes.
So, I've seen some guy saying, he was talking on one of the funny blogs, but that's why I'm asking because I've seen it on a blog.
Okay.
He said that P2, if you take P2 kwa prostitute?
Prostinator.
That one.
Postina.
Hiyo. That one. If you take it during ovulation, it doesn't work. So is that true? Asking for friends.
Asking for a friend.
Asking for friends. Not just one, many friends.
Okay, so go and tell your friends.
Okay.
So yes, actually how P2 works is it delays or stops the release of an egg, which is ovulation. And it also can prevent fertilization. So if ovulation has already happened, P2 is less effective. Yeah. Yes.
Meskia, friends.
That's why I say it's very important to understand why this particular medication, when to take it. Even some people take it after the 72-hour window.
And it is effective.
No.
Okay.
The window where it's effective is 72 hours.
72 hours.
For another one, it's 120 hours. But the most common one we have, which is P2, is 72 hours.
Oh, there's another in the
Yeah,
P2.
it's called ulipristal, I think acetate. So its window is longer. It's 5 days, which is 120 hours.
Wow.
But I don't see it commonly. It might be there, but I don't see it commonly
It's
in our
not very
markets.
common in
Yeah.
Kenya.
I don't even know.
So it's very important to understand that. So
Yeah,
P2 basically targets ovulation. Yes.
But tell your friends.
To abstain.
No, to take care of their womb. No, they will take care of an egg, of a basket of eggs. Yeah.
Elaborate.
Yeah.
That's nice.
Like you don't want to?
Like, don't risk. Why are you risking your whole womb? Like, you are carrying a generation. You are carrying a lot.
Hey.
Why would
She
you
said
want
you're
to
carrying
risk
a
it to something
generation.
that is just an ecstasy of like 2 hours and it's over?
What 2 hours anymore? That's a long ecstasy. That's so long.
Someone is there and you agree. Do you think? just be safe. So if you really want to indulge, protect yourself. So there's other methods of contraception that you can use, and there's an option for everyone. Yeah. So just go sit down with your doctor, find out what works for you, and then proceed with your life.
Proceed with your life.
Guys need to go to that episode of yours where the doctor said the men need to take responsibility.
They do.
Like we haven't reached there yet. So unfortunately, we have to protect
We must
us.
reach there.
You
We
must
have
take
to,
care
but
of your womb. It's your responsibility.
Wow. Kuna responsibility.
The harsh realities. Harsh
I'm just
realities
a
of
girl.
life.
Yeah.
If you don't do you, who's going to do
Who's
you?
going to do it?
Oh gosh. Okay. I had another one for myself. So mine is abortion.
Oh, okay.
Abortion.
Yes, abortion.
Legal or illegal?
None. As
Abortion.
a broad term.
Oh, okay,
Yes.
okay.
So medically, abortion means termination of a pregnancy before it is deemed viable, which is different in different regions. For us, it's 28 weeks. In other more developed countries, it's 20 weeks, 24 weeks. So termination of a pregnancy. Now, it can be spontaneous, meaning it's happened on its own. You didn't do anything to cause it. Or it can be induced. So it can be induced medically or surgically or through medical procedures. Yes. So why I said abortion is because I worked in Karatina. Yes. Unajua.
Nakumbuka when you used to, okay.
Yes. And many a times when I was writing the discharge summary, so you have to use medical terms, yeah? So I'd write, spontaneous abortion, and people didn't want that because, of course, there's stigma attached to it. Everyone just hears abortion and they're just like, oh, I know what you're trying to do. So abortion is just termination of pregnancy before viability. The viability is different in different regions, and it can be spontaneous or it can be induced. Yeah.
Okay, before even we go to not the main topic, this is
Yeah.
so interesting. It's like you know what we're going to talk about. Okay, maybe, of course you do know.
Yeah.
But I don't think you know so much because my case was actually termination.
Yes.
But now I've learned that it's 28 weeks in Kenya. When I went to the hospital, I was told 24 weeks.
So it depends. So some places it's 20. When we did med school, it was 28 weeks. But in the US, in like the UK, in more advanced countries, it's just, are you able to support this child outside the uterus? So in more advanced countries, they're able to support a 20-week fetus.
Oh.
Yeah.
Oh, okay. That's nice.
So that's what we term viability. Can we take care of this baby outside the uterus?
Okay.
Yeah.
Anything before
So
14 weeks?
we can't.
14 is...
Yeah, 14 weeks.
But
we
it's
can't.
still abortion.
It's still abortion, but now we term it now as spontaneous abortion, which we know as miscarriages. Yes.
Okay.
So there are different types of miscarriages. We'll talk about them.
Yeah.
But I just wanted to make that clear because, sometimes you can get your discharge summary, for like insurance, something that has to be according to the book. You'll see such a term and you're wondering, it wasn't an abortion. Yes. Yeah.
Okay.
Sure.
That's a big dose of health.
A big dose.
So guys, why are you here today?
Wow, you called us. And we just said, okay.
You said I'll come.
Anything
We
for
said
hope.
we'll
Oh, I like that. But October is Pregnancy Loss Awareness Month. And I know you have stories to share, to encourage someone, to help someone learn, and at just could release sometimes.
Yeah, sure.
Yeah.
Sana hapo.
So we just want to create awareness around pregnancy loss, to hear your experiences, and to learn kidogo here and there. So right off the bat, what was your experience? First of all, just pregnancy, like how did you find out? Were you expecting it? How was it?
For me,
Yeah.
I was very young.
How old were you?
I was 21.
Okay.
I was 21. So I wasn't expecting it, but definitely, if you go to the shop
Yeah.
to get yourself some cookies, you
Yes.
get the cookies. So exactly.
And
the
you're a
point.
teacher.
So I wasn't expecting it. So I found out I was pregnant. I used to have a regular cycle.
Yeah.
So if it didn't come, it meant that some small human being was inside my tummy.
Yeah.
So that is how I found about it.
Okay. What about you, Lily?
Wow. How I found out. I was not young. I was 30.
30 is young, by the way.
Really?
That is young.
I'm a
What
young
do you
girl
mean?
from today.
30 is young, yeah.
I found out like a month and like 2 weeks in.
Okay.
One, because I have PCOS, so sometimes my periods are also not so regular. But mine were not like months not regular, they're like 2 weeks not regular. You get me? Like I'd stay like 2 weeks without getting my period, and then it'd come. Or like mostly I've gone is a month.
Okay.
So even when I did not get my period and the app is telling me you could be pregnant, I'm like, shut up. You're lying. But how now I started realizing is someone was cooking and the smell of nyanya. It's not even onion. People say onions, me it was tomato. I was just like, But I thought, hey, maybe it's a prolonged hangover.
Yeah.
So I just said, oh well. But then now, I don't know if I'm allowed to say this, but I was just feeling like my boobs were sore.
Yeah, you can say that. What do you mean? I don't even allowed to say
I don't know
this.
if they'll cut off the word
Boobs.
Yeah.
It's a medical podcast.
But boobs is
You
not
can say
medical.
breast.
Breast is the
Breast.
word. My breast was sore and I was just like, hey, that's when I started realizing, okay, maybe I could be pregnant. I tested and I was pregnant. And I had not gotten pregnant for like a year. Not that I was actively trying, but I was actively engaging, which means if you're engaging, then something
It's
needs
either
to...
way. It can go either way.
When it was relating or not, I was engaging. So, of course, I could have been pregnant. But for a long time, I wasn't. So I just thought, I'm not those... Because, PCOS, you go and one of the things they tell you is going to be hard for you to get pregnant. So I just knew, it will take like my IVF to do my what. So I was just like, wow, maombi. So I was shocked. I was completely shocked, but a good shocked. I was happy.
Wow.
Okay. Were you happy at that point? Or
At that
what was
point,
your emotion?
It was a mix, but I wasn't like necessarily sad. I wasn't sad actually. I think I was happy. I was happy.
Okay. I tell you a statistic, not a common, like a shocking statistic that I saw. Majority of women, not majority, many women find out they're pregnant when they're having a miscarriage.
Wow.
Yeah. I think it was 1 in 8 women.
That's a lot.
Yeah, so that's why I wanted to find out, did you know you were pregnant, or did it not go well? And then that's when you're like, oh my goodness, I'm pregnant. Okay. So that was an interesting statistic.
Yeah, that's a very interesting.
Yeah.
1 in 8.
That's a
1 in
lot.
8. Yeah. And actually, even 1 in 8 pregnancies ends in a miscarriage. So it's something that's very common. And I know we don't talk about it. There's a lot of stigma around it. But it's something that is very common. So we need to talk about it more.
It's very common.
Yeah.
Actually, among my friends, if I look at my 10 friends, 3 have had miscarriages.
Oh, wow.
Yeah, so it's a common thing.
Yeah.
But why is it common with us?
What do you mean with us?
Our generation, I feel like my mom, like when we found out about what was going on for me, my mom was like, they didn't hear about these things then. Is it that they didn't have the medical capability, or they didn't know? Because the miscarriage is now...
Stigma hasn't started recently. So maybe it was just one of those things that's not talked about.
They're just quiet
at
about
all.
it.
Yeah,
Okay.
sure.
Like you go to the bathroom, maybe you see some blood here and there, a few things that might be, we call them products of conception. And you're just like, okay, yeah. But then also, I don't know, maybe you just knew you're pregnant when the tummy starts showing. Yeah, because maybe we didn't have such advances like a pregnancy test.
Okay.
Yeah.
True.
So now, okay, fine, you're pregnant, you're happy about it. Tell us more about the journey.
So I'm pregnant. And then I'm just in the process of processing I'm pregnant. Because I remember I was still in school. So I'm like, wow, how am I going to break this to my mother? And then again, I'm like, for me, at that point in time, abortion was not you see, right now, I would tell someone who was my age then, if they found themselves in a place they have to choose between education and getting babies, they can really they can ask for advice, but abortion is not that bad. But at that point in time, there was so much stigma around abortion. So me personally, I knew, even if I ever found myself pregnant, I would never abort. So I'm like, this one I'm keeping. See, I tell the boyfriend, and the boyfriend is, we can keep it anyway. So at that point in time, after finding that I was pregnant, and then sinikaka around, I remember it was the 3rd month. Then the 3rd month, it's when I go to the washroom. I am just doing my normal activities then. Blood.
I know, what's normal activities then?
I think I speak with a lot of coded language because of my teacher.
Were you washing the bathroom? That's a normal activity.
No, I was not washing the bathroom. I was peeing.
Yeah, okay.
Yeah, so a lot of blood is coming out, and I'm like, what the hell is happening? So one thing leads to another. Then I go back. First of all, I'm afraid what has just happened, because it was at night. I go back to the bed, and then after that, cramps sasa zikanishika. Niliumwa na cramps, mtu wangu. I never slept. It was around 1. I never slept for like 3 hours. I had to call for an ambulance because I couldn't even walk.
Wow.
Yeah, so I told my roommate, hey, manze naumwa na cramps. Then my roommate sasa aliamka, akaenda akaniitia neighbor. Neighbor akakuja, akaendelea kulala.
Wow.
So she continued sleeping, and that neighbor was a guy.
Okay.
Yeah, so that guy ndio aliita ambulance ikaenda. So my best friend was not living around where I was living. So she now came later. So I went to the hospital. They gave me like your emergency attendance, and then after now the emergency attendance, they referred me to now a bigger hospital. Yeah.
Okay. Wow. So you had cramps? You had the bleeding?
The bleeding.
Okay.
I cramped the whole night. I was crying. I was crying. Then now I go to the hospital. I don't know what they gave me. I think they gave me a painkiller. So I slept. Then I wake up in the morning. They told me, you are having an abortion. You know, the doctor.
Yeah.
It's a miscarriage, but we call it an abortion.
Yeah.
That is when I knew now. Miscarriage, when it's before, like, hapo alisema, like, before 3 months. 3 months is how many weeks?
Like 12.
12 weeks, yeah. So akaniambia before ifike, like, ikiwa 3 months, 4 months is still it's medically termed as an abortion.
Yeah.
So akaniambia, now you will have to do the DNC procedure. The DNC in full ni?
Dilatation and curettage.
Yeah, that.
Well, so basically, basically what they do is they dilate your cervix and then now remove the products of conception.
Being a woman is tough.
It's tough.
Yeah.
Yeah, so, and it is, they do not put any anesthesia, even if they I remember they put anesthesia on me, but it was very extremely painful. So first of all, you know, it's a private hospital. So I'm like, I have to get money first so that I pay, and then now they do the DNC procedure, because the doc is like, those remains of conception cannot stay inside your body because they will cause more harm than good. Yeah. So, and then, so I got the money. Then after getting the money, so they did the procedure. I think that was the day I saw.
Siwezi shika mimba tena.
Hata sikushika mimba, sikaribi mtoto. Kijana wenyewe tena. You know, you're facing up the roof.
Yeah.
And then some, as in, you know, it's like a pump. They put the ile chuma yenye unaekanga ukifanyiwa cervical whatever. Ile cervical speculum. Then now it's like pumping. So
so
it
now
was painful.
That's a different procedure. So that one is called an MVA. So we call it manual vacuum aspiration. So it uses a vacuum to suck in the products of conception. Yeah.
I've never felt that kind of pain, man.
I feel like I like hearing these experiences. Not that I like wishing these experiences, but it's good to hear that it is painful. You know, sometimes as a doctor, you can't relate because you've never gone through it. So when someone is telling you it's painful, you're like, but we give you a painkiller, you know. Yeah.
So what is it? What is DNC?
DNC, it's just dilatation and curettage. So it's used for many things. It can be used for termination of a pregnancy, but also for other conditions. Yeah, so if you have, there's something we call...
So how do they
remove? So it's like a... How do I put it?
That guy used
it's like a thingy, it's metallic, and then it has a rigid edge. So it does this.
I think
gently.
They did both.
They did both. Yeah, it
because
does
after doing
gently.
that, it's now when they pumped. Now
so they did both.
It was painful. Oh my God.
Yeah.
I hope men listen to this podcast.
They better, because pain management is such an area that I think we need to pay more attention to. Yeah.
And so that also they can be a support system, because they just think, I'm saying men, because rather than you've just gone through something, it's over and that's done.
That's it, yeah.
I'm sure after that you just needed that
tender
support.
love and care.
So much care.
Yeah.
By the way, when I went to the hospital, before everything else, I had to do a scan so that they can know what is the problem.
Yeah.
Because I was just bleeding. Then, now in the scan, it was saying some sijui what, I can't even remember the term, but it was about remains of, there is a mass that, it was just a term about mass remaining in the cervical, what, not the cervical, the uterus. Yeah, the uterus is seen to have some mass. So after that, now it's when I had to go for the procedure.
Yeah. Okay.
Yeah.
What about your
Mine
experience?
was not that well. For me,
And sorry, I forgot to ask, how many weeks? You were 12 weeks at that time.
It was 3 to 4 months. So
3
it
to 4
was
months.
between 12 to 14 weeks.
Okay.
Yeah,
Okay.
12, 14.
I was 6 months by the time I was going through my procedure. So for me, I just found we do that scan. I forget the name.
Anomaly.
That one.
Yeah.
You do when you check every organ for the baby. So when they did, I used to go to the hospital every month, because during my pregnancy, just when I found out I was pregnant, I found out I also have a UTI. So throughout my pregnancy till the end, I was consistently having a UTI. So because of that, I had to go to hospital quite often. So every time I'd go, I'd always want to just scan the baby. Because you don't need to, but I just said nataka kusikia heartbeat, nataka kufanya nini. So when you go to that 5 months, the anomaly one, the scan, they did, and then they found out. First of all, she started saying the spine is fine, like they just say everything is fine, but she took so much time when she was scanning the head. I was so tired. I even told her, hey, let me sit kidogo, my back is paining. And then I asked her, why are we taking so much time? She said nataka kuangalia kama kichwa iko sawa. So I said, what is it? Like, is it that something is wrong or what? So anyway, she said, I want to be very sure. So she continued, she did her thing, and then she told me she can see there is fluid in a vertical in the baby's brain.
Wow, yeah, you even got the terms.
I'm about to be Dr. Lily. Yeah, so I said, wow, okay. But you see, with that, I even, after she was done, before I saw the doctor, I started reading through it. And I could see you can have a catheter. It's called a catheter. Canter. Something. The one that you put and then it drains out the water.
Oh, a
Catheter.
No, they call it something else.
It's
not
a
catheter.
something.
Let's
That
call
one.
it.
Remember.
Yeah, we'll remember.
Yeah.
So I said, if that one, then if the baby is born, we can do that.
Oh, so they were thinking of hydrocephalus at that point.
Yes.
Yeah.
Is
Yeah.
that the one?
Yeah,
But
that's the word.
that's the one in the brain, not in the ventricle.
Yes, it's in the ventricle.
Oh,
The
it's in the
fluid is
ventricle.
in the ventricle. Yeah.
Oh, so now that's what they said the first time. But now when I went to the doctor, he explained, and the first doctor was like, this one would usually advise termination.
Okay.
And I'm like, but sinimesoma, you can just drain the fluid. So of course, I'm sorry, but it was just a general doctor. So I said, wewe ujui kazi yako, unajua tu kazi ya homa.
Okay.
Like I'm sorry.
Ulisijudge.
I at that time I was just like,
Yeah.
no, you're not telling me. So I
Say
went to
my
a-
apologies.
I'm sorry, daktari. So I said, let me go to a gyna who anajua
Yeah.
mambo huko ndani. And the gyna equally told me the same thing. But now the gyna has a 4D. You see, this machine you're doing is like, I think 2D. But the doctor had a 4D scan machine.
Okay.
So that one we could see like the whole
Everything.
shebang. So now that's when we found the fluid is not on the ventricle, but in like the brain is divided into two. So there was fluid on that side, one side. I'm not sure if it's the left or right. So that means this side where the brain is supposed to grow, imeenda kwa huyu mwingine. So upper, there's nothing.
Okay.
So that child would just completely be... If I was to give birth and let the child live, the doctor told me the child may not even spend more than 3 days. Or the child could be in machines for the rest of his life. So I was just like, wow. Now that second doctor told me, I'd advise termination. Then I said, hata huyu ajui kazi yake, naenda kwa neurosurgeon. Hao ajui, naenda kwa sasa mtu wa brain. So I went to the neurosurgeon. He's a friend of mine, but he's also a neurosurgeon. I called him, I was like, bro, this is what I've been told. I went with all the scans ever since I knew I was pregnant. And he just looked, no, the last one is what he needs anyway. So akaangalia akasema, wow, for sure, this one is not gonna be it. And yeah, that's how I terminated my pregnancy.
Oh, sorry for that.
Yeah, but the child, I was how many weeks? I was 24. So you see, at that time, that's when I thought, because he told me if I pitisha, there was a week, it was just during that time for Christmas.
Yeah.
So it's like, we better do it now, because if it passes the week for Christmas, then now ethically it is not right. I was just like, sasa mnaniambia aje.
Yeah.
So I had to do it that time. Like, it was like, you don't have time, because I did that,
The scan.
the scan a bit later. Instead of 5 months, I did almost like a week or 2 weeks before 6 weeks.
Okay.
6 months rather. Yeah, so hapo ndo wakaniambia terminate. So after the third one, that's when I said, wow, madaktari basi wako right. Wote from hata kama ule nilidharau, wote wako right. So that's when I just said, okay.
But imagine it's okay to get a second, a third, a fourth opinion.
Yeah.
If it gives you peace,
Yeah.
it's fine.
Yeah.
So now what? Because I know your process was different from hers.
Yes.
So how was your termination?
My termination was I took pills. So I actually see these pills being advertised or people talking about them on TikTok. And I'm like,
On TikTok?
Yeah.
On TikTok?
Yeah. I'll show you a TikTok. I don't want to say the name of it.
Okay.
But it's like I usually wonder why are people talking about it so casually? Because
Misoprosto?
No, I don't remember the word.
Okay.
I'll
It's
show
okay.
you.
So,
It's because the process, my God. Anyway, I took the pill the day before.
yeah.
So the doctor told me this pill is supposed to terminate. Then now I went to the hospital. I did 24 hours. Then I went to the hospital after 24 hours. Then I took another pill. And now I labored for 7 hours. So with every hour, I was being given a pill. Just
Every hour?
Every hour. After now, like going to the hospital.
Yeah, because I didn't start like it was small labor, like ile to yeah. So he said we have to keep inducing until you have the show. It's called a show.
Yeah.
Yeah. See, I'm about to be a doctor.
Yeah.
Show is now the
The
discharge.
blood,
Yeah.
that one that shows you it's time.
Yeah.
So I did that. I took pills. I think I took around like 6 pills within that time. And
Where were you putting them?
in my mouth.
Where?
Under.
Meza too. The first one is the one I was told to put here.
Okay.
But the other ones I was just swallowing
Okay.
with water.
Okay.
I think. Yeah.
Okay.
Yeah. So then after some time is when now the doctor came. I generally did a whole delivery. Like I pushed the baby out, which guys who go through labor, congratulations.
Yeah.
Because
Yeah.
So after the show, I took around like maybe 15 to 20 minutes. And then the gyna came and then, I pushed the baby and the baby came out. And now the thing is, I thought when the baby will have come out, he'd have already like gone. But he did like 2 to 3 breaths. And that is what broke my heart. Because like he's gone through so much, you know. And and then after that, now the hospital asks you if you want to go with your baby or if you want to keep it, if you want them to dispose or use it for medical whatever's. I chose for them to keep it because they said if I'm going to bury the child, it's going to take a lot of papers, a lot of police work. I said, I've had enough, guys. I did my goodbyes the whole night to the morning, then I was discharged.
Okay.
Yeah.
You were discharged the next day?
Yeah, the next day.
Okay.
But do I continue?
Yeah.
Okay. After being discharged, which I feel like they shouldn't have because I still had this remains you're talking about. I didn't even know there's something like that.
Well, they hadn't told you?
Yeah. So
Okay.
you see, I'm going to say it as raw as it is.
Yeah.
When I delivered, there's something they do your cleanup. But they... So
Just say it,
intrusive.
just say it.
Like I'm just remembering how intrusive it was. You know,
Yeah.
they do the centimeter dilation checking.
Yeah.
It's something like that. But her whole hand was inside and now she's scooping things out.
Yeah.
So she did not finish. The nurse who was with the gun. Because after I delivered the guy na ya ameanza kazi yake ameenda. So the nurse is the one who remained to clean me up, to do those things, and she didn't do a thorough job. So I've just gone home. Like after the next day, my mom came, picked me up, we're going. And I think a day later is when like now I was also doing my normal business in the washroom. I'm just peeing, but I feel like I need to push something. Like there's something distracting me up there. I don't know how to explain it. So I just said, okay. And I tried to push it and some lump came out and I said, what is this? So of course I panicked. I called the guy and he said, you need to come. So I did a scan and then they found out there still remains inside me. So they wanted to do the vacuuming because that's what they said they do.
Yeah.
But I go back to the general doctor. I see the first doctor.
Yeah.
He told me, don't go do it. Just itajitoa. Trust me. Give it like 3 days. Everything will come out. So just make sure. If ukiona hakuna kitu imetoka, come for a scan. But if you see things are coming out, that's good progress.
Yeah.
So within like 3 days, it was after Christmas. On the 27th, I went and they scanned and I had nothing. So I didn't need to go through the vacuuming and I was like, thank God. Because your experiences, you see, can hear, I was just like, I have to go through something else. So yeah, that was my process of pregnancy to delivery.
Where?
The part that actually delivered a whole baby is what I was just like, wow. And up to date, I still think, should I have just like kept and waited to see? But then I'm like, if they all said, and the best is this, then I believe
Many
them.
times we try to balance like now quality of life for the child versus now the option of termination. So it's just giving you both sides of the story, and then now you make that decision. So it can be a rough thing to like kind of tussle with. So it's very understandable that you go back and forth trying to understand, should I have done this? Did I not do the right thing? But well, all I can say is you're not alone. And that's why when people talk about the experiences, I feel like keep talking because that's part of, it's part of therapy, it's part of just releasing and finding that support. So now why I wanted the two of you is because you have different experiences. And it's very true what she said, that at 14 weeks, the management for termination of pregnancy is different versus at 20 weeks. So I remember I had a similar experience with a patient who was, I think she was 22 weeks. And now how she had come now when the termination had started. So the baby had already started expelling itself. And I feel like I'll never forget the words. She asked me, can you just push it back? I felt so bad. Now it's a night call. I'm an intern and I'm just like, oh my goodness. And it's very easy for you to feel like it's at night, I want to sleep. But then I was just like, imagine this is someone's worst day. Yeah. So I was just there with her. I just told her, unfortunately, like once it's come out, like there's nothing else we can do. And I was just like, for someone who doesn't know what is going on and this whole experience, it can feel very rushed. Do this, do that, do this. So even like when it comes to signs of, you never had any signs of termination of pregnancy, but apart from what she mentioned, there are other symptoms. So you can have cramps, you can have discharge, and for some ladies, it's just spotting. Not even like lumps of blood, it's just spotting here and there. You can have your pregnancy symptoms just disappear. Yeah. So, as I mentioned, there are different types of abortions. Let me give you a few of them, the spontaneous ones. So, what you are having is called an incomplete abortion. So, basically, some of the products of conception have come out. You had some labor, some cramps. Some women might not have cramps, but you had some. But then there's still something left inside.
A lot,
you
not
cramped
some
inside. Sorry, there is cramps. Yeah,
I cramped a lot.
Yeah, so that one would be incomplete. Now, complete is where now everything would have come out, maybe by the time they get to the hospital. Then we have two others. So there's threatened abortion, and then there's inevitable. So let me just start with inevitable. Inevitable is when your cervix is opened. The fetus is still alive inside, but there's not really much we can do. You're cramping at that time. So it's looking more like it's going to go to an incomplete or a complete abortion. And then there is now a threatened abortion. So threatened is where you're spotting, your cervix is a bit open. So at that point, we can try and step in and try and maintain the pregnancy. Yeah.
Threatened. Okay.
So sometimes, I don't know if you've heard, there's some ladies who are normally put on progesterone. So it maintains the pregnancy. So they'll be on progesterone until like 20 weeks. So sometimes maybe you just don't have enough. You're not producing enough progesterone. Yes. So anyway, this was just to see the different
What
types
about
of
this
abortions.
one when you're told that your cervix needs to be...
Oh my goodness. You guys know so much. It's called sacrilege.
Experience.
Yeah, so, okay, fine. Let me now go to the causes of abortion, of terminations of pregnancy now. So it can be due to a number of things, and many a time, 70% of abortions, or let me use miscarriages, 70% of them are just due to chromosomal abnormalities. And that's why many of them happen within the first trimester. So you did nothing. It's literally, you did nothing. It's just a chromosomal abnormality, and the baby
goes.
just Then we have now hormonal imbalances. So maybe you're not producing enough progesterone and maybe you need to be supplemented. But now for this, it depends on like how early or how late you've come. Then we have infections. As you mentioned that you always had an infection. Something about pregnancy is it's an immunosuppressive state, meaning your immunity is low. So you keep getting frequent infections. Because UTIs and fungal infections. So those can also lead to an abortion or like a miscarriage. What else? Now, the bigger your pregnancy gets, it's about, can the baby fit? Is there enough space for the baby to fit in there? So now anatomical abnormalities, not just for the baby, even for you. So you've heard of like ladies who have fibroids, especially the inside the uterus, they're occupying space.
Yeah.
So if the baby is growing, they might not be able to feed. But that doesn't mean that it'll end in termination of pregnancy. For some ladies, it's just that now you become a high risk. So we have to watch you very closely. Then even just how your uterus is shaped. There are different shapes of uteruses. People have 2 uteruses. Others have like a division in the middle. Yeah, so it depends on now the anatomical structure of your uterus, and that can influence now the pregnancy. And then now there's also how the baby is growing. Yeah, so there are different causes, and now that is what can lead to an abortion. Yeah, I think another one I had that I think because of what's happening now, you've heard of this whole Tylenol story. Mnakwanga kwa internet gani?
Sio yako.
So the president of a certain country said that Tylenol is not safe in pregnancy. So Tylenol it's a brand name. It's basically acetaminophen, which is Panadol, Cipladol. It's a painkiller.
I think I had something like that.
Yeah. So as we know, it's the safest painkiller in pregnancy. For anything in pregnancy, pain, Panadol.
I think I saw it on your socials.
Yes.
Yeah. You talked about it.
Exactly. So if we now move into other medications, now there are things we call NSAIDs, which are diclofenac and the likes. They're not safe during pregnancy because they lead to stillbirths, miscarriages.
Okay, I've known that painkiller.
Yeah.
The one you're talking about. Because that's the one I also suffered from. Calcium is bad. Because I used to take calcium. So it's like I had constipation for like a month, and I said, you know what? I'd let my teeth fall off now. Because if this is why I was really suffering. So every time I'd have like, this is gonna be deep. I'd have constipation. There's something called, what are they called, those things that come out of the back? Hemorrhoids. Yes. So because it's painful. Yeah. So I used to have ejections. That one, you say
Tylenol.
That one.
Just say Panadol.
Yeah. But it works really fast.
Yeah. And it's not a safe painkiller in pregnancy. Yeah. So it really depends on like.
So they have said it's no longer safe.
No. Of course, now the medical fraternity has come out and said that it was. Some studies have shown that these are a risk. And what was it? It was causative versus. What's the other word? So it's just linked to certain cases of things like autism, but there's no study that has actually proven that it causes
autism.
Yes, causes autism. Yeah, so it is safe. We still use it.
Are they talking of autism? A lot of kids are autistic nowadays.
There's a lot of diagnosis of it. So there's a lot of questions of, is it because now is when we have the tools to diagnose it? So maybe it existed, but then now that we are more aware of it, we're able to pick it out more. But that's a whole other topic. Let's not even go there. Yeah, but I just wanted to say the different types of abortions and also the different causes. Yeah, but most of the time, you did nothing. You literally did nothing, yeah.
But this
chromosomal,
that one,
yes.
That means like my egg and that sperm were just not together, right? Yeah, because that was how the doctor was explaining to me. Because you know this jargon you guys use, I'm just like, make me understand.
Make it make sense, yeah.
So he was just telling me, just literally the egg and the sperm were just not compatible.
Yeah.
So why does that happen? Is there a way you can prevent it?
There, maybe. But if you were going to prevent it, we'd have to know now your chromosomal build. That's why in some countries, the earlier your pregnancy, chromosomal tests are something that we also encourage. So screening. So even for things like Down syndrome and the likes, you're able to screen to see if this is a risk to the pregnancy. Yeah. But it's very hard to know before any conception has happened.
But if, say, I'm married, like now, for me, getting pregnant, I was not married.
Yeah.
But if I'm married and I know this is the guy I want to have children with, would you advise we both do genetic tests to find out how we are? Yeah. I think that needs to be spoken about a lot. It's expensive.
It's
very expensive. Well, it's expensive because I remember the doctor telling me to find out the exact reason, like you pinpoint mtoto alikuwa na hii was around 110,000 just to find out the test. And that's minus every other thing. So I needed maybe like 200,000 to be able to do it all complete. And I'm like, wow, that's a lot. But he said, I start asking myself later on, I was like, is it advisable for me to do my genetic test and for my husband to do, so that we know to send it to jaribu kuzaa tena and then we're having the same problem. and the same problem. I think that should be talked about, and there needs to be a way, I don't know, how
Yeah.
they can make it cheaper for us. Because imagine going through, because for me, I went through pregnancy. I had nothing. I had no morning sickness.
Yeah.
My pregnancy was
It was
beautiful.
smooth.
Yeah.
I
Okay.
loved being pregnant, in fact. But now at the 6th month is when I'm finding out all these problems. I'm like, I should have known, like, way back. To a point, I was even saying the problem is the father of this child. Like, the use of tutakombaya. And I mean, so
Yeah.
I think, I don't know how doctors can do it.
I guess with more innovations, things become more accessible. They become a bit
true.
cheaper.
Affordable.
But for now, it's still very expensive.
Maombi.
Yeah. Ati maombi.
Nilikuwa naomba dia.
But then also, there's so many different genetic abnormalities. So it would be like, are you doing all of them?
Yeah.
You know, yeah. That's why we just advocate for the more common ones that we see, maybe within the first trimester when they are recommended. You screen for that, and then now you can progress.
But how would you know?
Yeah.
Like mine, how would you know? And
Now, okay, I don't know, because you see, first of all, I need to know what genetic complication it was. But then for something like, let me use Down syndrome, because I have an aunt who actually had a child with Down syndrome. And we're just like, if you're able to screen mapema, then you get to understand that this child has Down syndrome. And living with Down syndrome is not it's not a death sentence, and there's different levels of severity to it. So you just know that this is this type of pregnancy. Then you also prepare the mom for the outcome, because I mean it helps mentally as well. But there are so many other genetic tests. But we have maternal-fetal specialists. Those are the ones who actually study the fetus in utero. Yes, yeah.
so you can be able to know even when someone is still pregnant that they'll have Down syndrome or something.
Yeah.
The child. Oh, really? At what point?
So the first trimester.
Oh.
Yeah. There's a screening test for it.
Oh.
Yes.
Okay, I just knew about that one for the spine. Is it that one that you check if the spine is well or something like that?
No, that is now neural tube defects. Now that's like an anomaly. Let's not go deep into that.
So
but
deep.
now that one we'd see in the anomaly scan mostly, because now the baby's a bit more formed, able to see structures properly.
Which you see, I'm saying it's so late into the pregnancy.
I know.
Like you're literally at like 5 months. That's
Yeah.
so late. So that's why I'm saying I wish you could find out early. Like you're pregnant, they start doing the test to find out if
Innovations, don't worry. Medicine is also
Technology.
evolving.
can't wait.
Yeah. But now we've talked about now the pregnancy, the termination. It doesn't end there. Now after, I know there's a lot of, there's a mental load that you carry with yourself. And majority of the women who have gone through that blame themselves. Well, many times there's nothing you could do.
Yeah, true.
How was it for you? And did you feel supported? What did you wish was maybe done a bit better? Yeah.
Personally, I wish someone told me I should go to therapy. Like,
Yeah.
that is loss. As in, we cannot say it's a small loss. It was a major loss. But at that age, I feel like I lacked the right support system because I started chasing now. Can I become pregnant again? I want to prove to myself.
Yeah.
Am I the problem? Is it because of me? Like, am I feeling this way? Did it happen because I have an abnormality?
Yeah.
Or is it because I can't carry a pregnancy? So I wish I would have gone to therapy, and I wish someone told me to go to therapy because it was a major loss. Because I actually got pregnant again and miscarried again. Now that... Yep.
After how long?
After like 1 year.
Okay.
2018, 2019, yeah. After like 1 year. Yeah, so I got pregnant again, and then I miscarried again. I went through the same process, gosh.
Was it the same experience?
Same experience. Then you just wake up, you go to the washroom, you're just peeing, and then again you're bleeding. And then the continuous process. I still went to the same hospital, and I'm like, wow, so what will I do? I remember even a friend of mine told me, imagine aliniambianga wewe, you have a medical problem, you can never become pregnant.
Never.
That's not a friend.
That's not a friend.
That's not a friend, yeah. Not a friend. The person that had made me pregnant.
Had to be a man.
The father of that child.
Yeah.
Oh my goodness.
Yeah, they told me, you have a medical problem, you can't become pregnant. I think that defined my consecutive decisions I ever made in life were defined by that. And if I was to go back in time, I would definitely, like after the first loss, I would seek help, seek therapy, and I would have like just from inside, I know I am not the problem, and get a support system that helps me to heal and to go through the loss and grieving and everything. Because I never went through grieving, I never went through loss. Life just continues back and back. And then I'm like, I want to become pregnant. Even I remember when I was getting now my current child, I was like, Mimi, ata I don't want, because first of all, you see, this is a man telling you have a medical problem. So I was like, maybe by the marriage is not for me. But because now imagine someone who was supposed to hold your hand is not even holding your hand in that process. So I was like, I want to get a baby for myself. Like I just wanted, there was a solace that I was seeking outside of me, that it shouldn't have gotten to that point, but it got to that point. So I was seeking that solace that outside of me, I need to get a child. I needed to prove a point to myself that I can actually carry a baby and become pregnant and give birth and be a mother. Yeah, but I thank God I'm a mother. That baby was prayed for.
Oh,
Yeah, she was prayed
and she
for.
knows.
Yeah, she knows.
You see how she handles her baby. I'm just like, wow, that's so cute. Like, wow. What about for you, Ayisha?
It's interesting. She said something, and I'm like, yeah, that's exactly how I feel.
Tell us more.
I don't want. It got to a point where, I mean, I also didn't have the best support system in terms of the father of the child. But for me, it was neither here nor there. I have such great support from my family, my mom, my brother, my sister-in-law. Those are the three people I always mention because they were there for me. They still are very there for me. So she said there's a point you just want to get a baby for yourself. I don't even want for marriage or anything. For a long time I've always been the girl for I want to be married, I want to have children. But now after losing my child, I genuinely the next day I wanted to get another child, and I wanted for me like I just because when I tell you I enjoyed my pregnancy, I enjoyed it, and I couldn't wait to be the mom. So I wanted to be pregnant again, and this time I kept saying I don't care about like the family setup. I just want it for me.
True.
Which I don't know if therapy can help you with that.
Therapy should help you.
It should.
Like after growing up, I'm like, my baby needed, actually. I was selfish enough not to choose a father for her. Like I wanted the baby for me, not to be in a family setting. But I think if I went to therapy then I would have healed. But now that I am healed, I make better decisions.
Okay, I love that. Because I went for therapy and I just
what does that mean?
I was just like, atusaidiani hapa sister. I went to a second therapist and I'm like, atusaidiani.
But I also think sometimes you're not ready for therapy.
Oh, okay.
Yeah, so you're not ready to heal. So you can be trying this, that, and everything. But if it's not coming from inside.
But I think therapy has come post-COVID. Like, I never heard about therapy before COVID. I never used to hear about people go to therapy. It's become a jargon after now. Like, Amani Villa, I have grown up. I was still
We have a friend over here. Okay, he's finished. No, sorry, you were saying something.
So I was saying, like, therapy is being talked more about post-COVID. Like before COVID, I never used to hear people talking about therapy. I was young, I never, but I still had access to social media. So I think if I was in this age and I got a pregnancy loss, like to any woman who would go through the same abortion, miscarriage, you should really go for therapy. Not even necessarily the therapy you have to pay a professional, but even
some sort of counseling.
Yeah, some sort of counseling. It could be pastoral, it could be through friends, but seek support within your circle and grieve the baby, because if you don't grieve it, you carry the sadness and the hurt and you will bleed it on other people.
Okay. I think to answer your question, I don't think mental health has always been there. We just have never paid much attention to it. And especially like in African settings. So now it's becoming more and more acceptable and people are taking charge of their mental health. So that's why it's becoming more and more common. And also COVID, COVID was a period of isolation. If you think about it well, when you're in isolation, you sit with your thoughts. So it's like now you're aware of your state. So many people saw the value in therapy, and that's why more people are actually seeking
seeking the help.
Yes.
And it became even more accessible. I think back then the therapists were not as many.
Yeah.
Now at least there are many. So even if it's in terms of like I always say finding a therapist is like going on a date, because it's like 1, 2, 3. I don't like this. I like this. I like this, until you find someone you actually like. And now the scope is wider, and even the price range has become like more affordable now. Back then it was crazy.
That's true.
Yeah, true.
That's true. Yeah. So support is very important. Mental health is very important. But I think your family can support you, but also there's the inner work that
That's
you
actually
need
it.
to do. Because if you need to be in that state of, yes, I'm ready to receive this. And that's why we say take the time. Yeah.
Take the
time. So now something that I think, Lily, I saw you talking about this on your social media. Going back to work for you, school for you, you know, as you said, life keeps moving on.
Yeah. It's a
So
roller
how
coaster.
was that for you? Because I know for miscarriages, not everyone has agreed on maternity leave or like what is it, compassionate leave, you know, so how much time do you get off to just recoup? So how was that for you, and what would you wish it was, knowing what you know now? Yes.
It was nothing about resting. See, I was still in school, so
Yeah.
I had to wake up and go to classes. So I remember I slept for like 1.5 days after the process. So after sleeping for 1.5 days, I woke up, I bathed, I tapped myself, and I told myself, tujikaze, we are still in school. So I went back. I started doing just the normal processes, but in a delayed way, because there is still pain. Like, we don't talk about the thoughts that even go in your head. Like, you know, your thoughts can even finish. You do hear people who start talking alone because their thoughts are just shouting at
Your
them.
mind can be your biggest enemy.
Yeah. So there is just that much. And now the grieving, when you get to your bed, you have to cry on the pillow and everything. But apart from that, what I wish it was right now. Okay, I wish I was given just like a leave, like for 1 month. A pause on the life, and just to recuperate and to self-reflect and to heal. Like the way Lily was saying, she just woke up and told herself she needs to stand up and go. I wish I was given that time to tap myself and tell myself, accept it, because you can't change it, and like just as a small process, but not fast, because life was moving and I had to cope.
Yeah.
Okay.
True.
For me, I thank God I was not employed at that time, because I had left work about, I think, maybe 6 months or eight, whatever months. I was not working, 6 to 8 months, somewhere there. So actually, no. 8 months, around about that. So I always usually say thank God I was not working, because I wouldn't have been given time to just sit by myself. So I when that happened, first of all, people need to know that you bleed for like another week. So, and that bleeding is intense. Like, I used to stand up and feel like I'm going to faint. Like, you're dizzy, you're all that. So there's no way you can get back into a normal life. So for me, I thank God I took time. I took time before even starting my business, my floral business. I started in Feb. So I took about like 2 months. So I healed. I had the time to sit down, to cry, to heal, like physically and mentally. Okay, I mean, you can't heal, but like feeling better.
Yeah.
But now, when you saw on my social media, it's because I was so surprised to see that people get back to work the next week. And I was like, something needs to change, guys. Something needs to change. Because I couldn't imagine myself working a week later. I don't even know how you did it. Like, you're saying 1.5 days, girl.
And you think she
said,
herself.
amka dada.
Yeah.
Nenda zako. We are really strong people. Women are so strong.
Women are so strong.
Yeah.
Because it was hard. So, my experience was I took time to heal, and I had support. So I would not even leave bed. Things would be brought to my bedroom to eat, to do what. Yeah.
Okay. But yeah, I agree. I feel like we need time. Yeah. That it is a loss. Yeah.
It is a loss, like
so you need
any
to be
other.
given the time to heal. I think maybe we can agree on the timing. I feel like 1 month is good.
Yeah. But I was actually
like
saying
that-
3 months. No, kumbuka
3
nisema.
months. Yes, I remember you
the
said
way
3 months.
maternity guys have the 3 months to be there with your child and do what? Same.
Yeah.
But at a compassionate leave, your loved one, you're given 2 weeks.
Is
In
it
a work
standard
setting.
across?
Yeah, it's across.
Actually,
It's standard.
Compassionate
standard 2
leave
weeks.
is 2 weeks.
Okay.
So probably, let's say 1 month.
That would be like a safe spot.
Yeah, 1 month.
Okay. You've mentioned something that I know we can't end without me talking about it.
What?
You said you were standing up and you were feeling dizzy.
Oh yeah,
Yeah, so
like that blood loss is not kidogo. See, after delivery, because I did the normal, I don't know if it happens to girls also for CS, because I don't know, but because I did the normal delivery, the blood that comes out is not si kidogo, like it's a lot. So I remember the next day, I told you I left the hospital the next day, and then by the time I was going back to scan because something was happening, I was feeling like things I was just talking. I used to stand up and feel dizzy, like I'm weak, like literally. So the doctor told me you're shedding blood, and I saw someone saying on, I think TikTok, one of the apps, saying that people need to understand that the blood that is coming out even during your menstrual cycle is the same blood. Like hakuna tofauti ya blood. It's the same blood. So you can imagine if someone is cut here and that amount of blood is coming out, it's the same. So that's why even when someone is cut and it's coming out, these guys get even when you're donating blood, you get dizzy. So it's actually the same. Like, give yourself that grace of understanding. It's the same blood. So yeah, but you just need a lot of rest, I guess. When you deliver, I think that like 2 to like that 1 week, you need to just be chilling. Just be with your baby and just chill. And that's why I'm saying you need support. Because if I didn't have the support of like my mom and everything, and I know even if I'd have delivered my baby to term, I'd have had the same support. So if you're married and you're the husband and this babe gives birth, please, that 2 weeks you're actually told to be at home paternity leave, please just take care of her, because she genuinely needs it.
Okay, that's true, but you're not supposed to feel dizzy.
Daktari?
Yes, you're not supposed to feel dizzy. So what happens, especially after delivery, we need to ensure that the entire placenta has come out. Yes, so if anything is left inside, the uterus is not able to contract well. If it doesn't contract, it means the blood vessels are still very open, and it's bleeding is what happens. So that's why your doctor told you come back for evacuation. It's true they can come out on their own, but many a times if it's like clots and if you're feeling dizzy, that's a signs of severe blood loss. So you start feeling dizzy, you start feeling tired, you sweat. Yes, and your body can go into shock. So
those were actually the symptoms I had. I was sweating so much, I was dizzy, I was so tired. That 1 week,
so if you estimated your blood loss, it would be a lot. Yes, so that's why even you've had, especially some of the complications after a medically induced abortion, regardless of if it's through a pill or through vacuum or like whatever method was used, bleeding is something that we really have to take seriously because it can kill. So bleeding, infection, they can kill.
That's why some people die.
Yes.
Okay.
Okay. I wish I knew this then.
So even when you were saying her hand was inside, she was trying to remove the entire placenta. So that your uterus contracts and goes back to its normal size, and it's able to control its bleeding.
So these things that were the remains that I had were the placenta.
Yes. Because for you, especially at that time, her baby was formed.
My baby was completely formed. I'll show you a picture.
After now the process.
After the you pushed
when
twice.
you went home.
No, see, when I pushed the baby, then she tells you need to push again the placenta. I was like, mbona watoki pamoja? But so I pushed the baby and I pushed the placenta. But now I didn't know that whatever was remaining was there. I thought it comes out whole. I mean, it's because it's induced.
Sometimes it comes out whole. Sometimes it comes out
even
not
normal,
as whole.
like to term.
Yes.
Okay.
So we really have to be very careful in. We call that. It's the third stage of labor and delivery. So the placenta is something that's very important. So even when a placenta has come out, we have to inspect it to ensure it's whole. If it's not whole, it means there's some that has been left inside. If you don't remove it, the lady will bleed.
Wow.
Yes.
And let me ask you before we finish then. So after someone has delivered like a normal and the placenta has come out vizuri, how long do they bleed?
Lokia. So it's a mixture of bleeding and discharge. So it goes for about 3 weeks.
So 3 weeks, normal.
As it's going from red, it changes color, red to I've forgotten, but it's like lochia rubra. It has different names, but it goes until it clears. So you'll be bleeding kidogo and then discharge until it stops.
Oh, okay.
Yeah. True.
And I got my period like right after.
Yeah.
Which was so interesting. The doctor was so happy though.
Yeah.
Because like that means your system is working well.
Exactly.
Because I think after a month my period came back. But also I was working out, I was eating right. I wanted to, no, so I told you I wanted to get a
prove to
baby.
yourself, yeah.
I was like, we're going to work out, we're going to make our body ready for the baby. But girl, it's
That's
not
why
your
we
fault.
say after a miscarriage, you can get pregnant immediately.
Yeah.
Yeah.
Well, we had guys who in a month they're pregnant
In
again.
a month, they are
Exactly.
pregnant again.
Exactly.
Yeah, true.
Yeah, so we want to wrap it up. I know we can continue because there's so much to unpack around it. But I just want you to share with someone who might have gone through the situation or is still dealing. What piece of advice would you share with them? Maybe that we haven't mentioned or that you want to CCTiza. Yeah.
Okay. I think I just tell, for especially my girlies, it's not your fault. Like, it's not your fault. Whatever happens, even if it's, or especially miscarriages, I know, like, ile ya mwanzo ile you've just gone and sat down and there's blood. Usually feel like, oh, I should have sat down, I should have eaten this, I should have done that. It's not your fault. Like, just give yourself a lot of grace, babes. Give yourself a lot of grace. And grief doesn't end. There are days, Hope can tell you, there are days I'm literally somewhere, just having a good time, and then at night I'm crying. It doesn't end, but try as much as possible to give yourself the strength. Like, jitoe, you know, like, work on yourself so much. Don't wait for other people to come and pour in the work into you. You have to start, Ayisha, I'm doing this. Then when guys come in, it will be an easier way of healing. But and you'll be fine. You'll be fine.
They'll be fine. What I tell them, make sure you go through the grief. Like, take it like a loss like any other, like the loss of a parent, like the loss of a loved one. It's an equal loss. So go through the grief, through the 5 stages of grief, and feel every emotion that it is to feel. Because if you don't feel the emotions, then they will affect you later, or you'll project them to someone else, or to your future children, or to your future husband. You don't know. But go through the grief like it's supposed to be grieved. Because if you just put it at the back and life continues as normal, it will come haunting you. So you have to go through the grief to heal. But it is also not your fault that you have miscarried. It has nothing to do with you.
Actually, I think I'm happy you CCTized and the same thing. I think for me, just from listening, you're banking on me to hit the mic. Sorry. Just listening to both of your stories, I would say I had 2 different views. So Lily was a bit more, what's the word I can use? I don't say informed, but you made sure that you got different opinions.
May I ask
you
the
made sure that
questions?
like you were heard, your voice was heard. I know you were young, so sometimes it's very easy to let things happen. But please ask the questions. If you're in pain, ask for more pain medication. Like, don't just let things happen to you, regardless of how dire the situation is. Your voice should always be heard.
True.
Yeah. And then
That's very
also,
important.
I think I didn't ask about like how your experience was post. Like, were you advised well by the doctor? Did you feel supported at the hospital? I think it's also important to make sure you feel supported at the hospital. Yeah. And don't leave without the doctor telling you what to do. So I've just gone through this experience. How do I take care of myself at home? I think it's very, very important. You shouldn't have gone home without knowing how to care for yourself at home.
Oh yeah, that's the thing. Also, I should mention the doctor, the guy. I think he left a bit too early, because I went in with him as my personal gyna in a private hospital. So it was he was there for me. He wasn't there to do anything else. And he has his nurse. So when he finished, when that part shared, he left really quick. And I was just wondering why he would have waited there. All he did was just tell me that I'll get meds for stopping breast milk, and that's it. Like, he did not take care of me. I was very upset. In fact, when I had the strength, and you know me, I'm a complainer. I called him and I was like, listen. And I was even ready to even go forward and sue the hospital, because why would you let me go home with remains? Like, you know, in the point that you are, because even the doctor and the gyna didn't know. So when I called him and told him I'm seeing this, he was like, what do you mean? Like, when you're not talking with your nurse, I'm na communication hapa katikati. So also, I think doctors, the thing you've said, that make sure you're heard. Also, the medical department should hear, because you know, these nurses just think. Because I was so upset that there was one nurse and I said, I don't want to see you. And I thank God it's a private hospital that nikisema aende ataenda. Because I said, I don't want to see you. She was just like, unajua when ni first time, keep quiet. My first time mom doesn't mean that I am supposed to just go through the pain and feel like, take care of me. You're there to take care of me.
Yeah.
So yeah.
Yeah, you reminded me something. Now to wrap it up, before you
for real.
introduce before you introduce yourself, when you're going through a pregnancy loss, some of the things that should be done, you should have a scan to confirm what is happening. Once any procedure is done, meaning they've terminated the pregnancy, it's also very important to have a scan after, so that you can confirm that everything has come out. Yes. So I just had to make that clear. And I'm being told to wrap it up. So I'm going to wrap it up. But you guys want to be found?
Yes.
Plug yourselves. There we can find you.
So I'm on Instagram and TikTok. As Miss Heather. Miss
Okay. We'll
Heather.
put it here.
.ke. Yeah.
Okay.
Lilaisha, Ayisha.
Okay.
Lilaisha. Yeah, everywhere. You can find me everywhere. Yeah. But you can also find me in the club.
In the club.
In the club, you can also find me there.
Anyway, thank you guys for coming. It was just one of the ways we can create awareness around pregnancy loss and try and work towards reducing the stigma and just reminding yourself you did nothing wrong.
Yeah, true.
Yeah. And it's a wrap.
It's a wrap.
Thank
And
you
thank
so
you
much,
for the therapy.
Hope. Yeah.